By way of introduction, we stand at a pivotal moment in healthcare, witnessing a revolution not just in medicine, but in its very delivery. At the heart of this change is telehealth, a transformative innovation with the power to reshape access to care, especially for women who have long faced systemic health disparities. The promise of telehealth extends far beyond mere convenience. Its potential aligns powerfully with our global ambitions, the Sustainable Development Goals. It is a direct contributor to SDG 3, promoting health and well-being. It advances SDG 5 on gender equality, and it fosters SDG 9, building resilient infrastructure and promoting innovation. As we saw during the COVID-19 pandemic, this isn't just theoretical. The crisis catalyzed its global adoption, proving telehealth's vital role in ensuring care continuity when our health systems are under siege. Hamanyar and Dwab et al. 2024. But, and this is a critical but, this immense promise is shadowed by significant challenges. We cannot let our optimism blind us to the very real ethical and access barriers that threaten to exclude the very people we aim to help. Let's first consider the ethical landscape. When care moves to a screen, new risks emerge. We face critical concerns over the privacy and confidentiality of sensitive health information. We must navigate the challenges of securing genuine informed consent remotely, and we see threats to women's autonomy, particularly in sensitive areas like reproductive health, where decision-making can be compromised without the safe space of a clinical room. Solimini et al. 2021, Cantor et al. 2023. Simultaneously, the bridge to equitable access is crumbling under the weight of a pervasive digital divide. This isn't just about having a smartphone, it's about inadequate infrastructure, the barrier of cost, and low digital literacy. And it is compounded by deep-seated sociocultural norms and patriarchal structures that actively control women's access to and use of technology. Do Nascimento et al. 2025. A tool meant for liberation can, in these contexts, become another site of control. Therefore, we must be clear, realizing the full potential of telehealth requires more than just deploying new technology. It demands a justice-centered approach. This means moving beyond technical fixes to fundamental changes. We must embed robust ethical governance to protect our patients. We must co-design platforms with women, not just for them, ensuring these tools meet their real-world needs. We must invest in digital literacy as a core component of healthcare literacy, and we must implement gender-responsive policies guided by the essential frameworks of digital health equity and feminist bioethics. Our ultimate goal is unwavering: to ensure that telehealth fulfills its transformative potential, not for a privileged few, but for all, without leaving a single woman behind in the digital health revolution. Research question. Our research is guided by three central questions. First, what are the primary ethical challenges involved in telehealth integration in women's health? Second, what access barriers limit equitable telehealth service utilization by women across different contexts? And third, what research and policy gaps exist, and how can they be addressed to support Sustainable Development Goal, or SDG, targets? To thoroughly investigate these complex questions, our study employs a multi-theoretical framework. We begin by utilizing a digital health equity lens to examine fair access and outcomes across social and digital divides. This is combined with the principles of feminist bioethics, which provides a critical focus on power relations, autonomy, and intersectionality in healthcare delivery. Furthermore, our analysis is grounded in SDG-aligned policy frameworks that prioritize justice and inclusion. By integrating these three powerful perspectives, our research investigates how telehealth can both serve and marginalize different groups of women. We seek to understand how outcomes are shaped not by individual choice alone, but by structural factors like digital literacy, socio-economic status, and data governance. It is only by confronting these challenges directly that we can ensure the promise of digital health becomes an equitable reality for all women. Today, we stand at the intersection of technology and humanity, examining a tool with the power to reshape women's health globally. Telehealth. A systematic review of 23 studies paints a picture of both profound promise and significant peril. The potential of telehealth is aligned with core global ambitions, the Sustainable Development Goals for health, for gender equality, and for innovation. It promises transformative benefits, overcoming vast geographic barriers to provide timely reproductive chronic and preventive care. Yet, as do Nascimento and colleagues highlight in their 2025 review, the implementation of this promise is fraught with significant challenges. The path forward is obstructed by persistent ethical concerns. In a field often characterized by weak regulation, the risks to privacy, data security, and informed consent are prominent and alarming, as noted by Soleimani et al. In 2021 and Langarizadeh et al. Back in 2017. Furthermore, we are confronted by a deep digital divide that threatens to turn innovation into a new source of inequality. Women in low-income, rural, and underserved communities face overwhelming barriers. As Lestari and her team emphasized in 2024, these include digital illiteracy, poor internet infrastructure, and restrictive socio-cultural and economic norms. This inequity is compounded by a fragmented policy environment that lacks the coherent, gender-responsive governance necessary for success, a point critically identified by Abdel Wahab and colleagues in 2020. So, where does this leave us? When we analyze this landscape through the critical lenses of digital health equity, feminist bioethics, and SDG-aligned evaluation, the literature sends a clear, unifying message. Technology alone is insufficient. To bridge the gap between potential and practice, we must be deliberate. To ensure a just and sustainable integration, telehealth initiatives cannot be neutral. They must be explicitly designed to dismantle these structural and ethical barriers. As Lau and colleagues argued in 2023, we must leverage the Sustainable Development Goal framework not as a mere checklist, but as a blueprint. It is our guide to build equitable, inclusive, and truly progressive health systems for women worldwide.
Let me now walk you through the rigorous methodology that underpins our findings. Our investigation took the form of a systematic literature review, meticulously conducted in accordance with the PRISMA guidelines. The primary objective was to critically examine the integration of telehealth into women's health, with a specific lens on ethical challenges, access barriers, and its alignment with three key Sustainable Development Goals: SDG 3 for good health and well-being, SDG 5 for gender equality, and SDG 9 for industry, innovation, and infrastructure. To ensure a comprehensive capture of the existing literature, our search strategy spanned 5 major academic databases: PubMed, Scopus, Web of Science, KINIHL, and Google Scholar. We employed a targeted set of keywords to guide this search, including phrases such as telehealth and women's health, digital divide and gender, telemedicine and SDGs, ethics of telehealth, barriers to telehealth, and feminist digital health. We established clear inclusion and exclusion criteria to maintain focus and relevance. Our review specifically incorporated peer-reviewed open access articles published in English between 2015 and 2025. To be included, studies had to examine telehealth interventions, policies, or access issues in women's health and make a clear reference to at least one of our focal SDGs, 3, 5, or 9. Furthermore, the literature was required to address ethical, legal challenges or access disparities. Conversely, we excluded studies that were not focused on women's health or telehealth, those that discussed technology without a clear link to health or the SDGs, and any that lacked a discussion of ethics, social justice, or access. The screening process was rigorous. From an initial pool of 40 identified articles, we first removed 9 duplicates. The remaining 31 records were then screened by their title and abstract. Following this, we retrieved the full text reports for a detailed eligibility assessment. This process culminated in a final set of 23 articles that were included for the final synthesis. The data extracted from these 23 studies were then subjected to a thematic analysis. This allowed us to cluster the findings around the key areas that form the core of our presentation today, namely ethical concerns, the manifestation of the digital divide, the linkage to equity and the SDGs, and finally, the resulting policy recommendations.
We stand at a digital crossroads in women's healthcare. Telehealth promises a future of convenience and expanded access, but we are here today to sound a note of caution, because if we are not deliberate, this powerful tool risks leaving the most vulnerable women behind, turning a promise of access into a new source of disparity. The ethical minefield. Let's first consider the ethical minefield we must navigate. The very sensitivity of women's healthcare, from reproductive services to care for survivors of intimate partner violence, makes data privacy a paramount concern. A security breach here isn't just a leak of information, it can deter a woman from seeking life-saving help. Furthermore, the process of informed consent is often rushed and inadequate in virtual settings, failing to account for differences in literacy and comprehension. We must also confront the threat to women's autonomy. Gendered power dynamics within households can mean a woman lacks the privacy or agency to even use these services. And when things go wrong, a fragmented regulatory landscape offers little accountability, leaving vulnerable users exposed. Finally, we face the risk of encoded bias. AI-driven tools, if not carefully designed, threaten to perpetuate and even amplify the very inequities in our current system. The barriers to access. But the challenges are not just ethical, they are profoundly practical. For many women, the digital door is simply locked. Structural barriers like limited broadband, the high cost of data, and simple device unavailability disproportionately affect rural, low-income, and older women. And for others, even with a device in hand, a significant digital literacy gap prevents them from using these services effectively. Beyond infrastructure and skills, we face deep-seated socio-cultural walls. The surveillance of women's device usage by family members and the persistent stigma surrounding sexual and mental health can make a private, autonomous telehealth consultation an impossible dream. So, is the answer to abandon telehealth? Absolutely not. The answer is to build it better. Research is clear, we must move beyond a purely technical fix. We need a transformative telehealth model built on 3 pillars: digital equity, feminist ethics, and strong accountability. This means co-designing with marginalized women, not just designing for them. We must use participatory design to ensure services meet their real-world needs. Conducting regular gender and equity audits to proactively identify and correct biases and gaps. Investing not just in infrastructure, but in digital literacy, empowering women to use the technology confidently. Merely expanding internet access is not enough. We must tackle the foundational social and gender-based inequities that are the true root of this digital divide. Current implementations often favor aggregate reach over meaningful, intersectional impact. They fail because they lack the necessary monitoring and community-driven adaptation for true equity. Friends, colleagues, advocates, telehealth holds incredible promise. It can revolutionize how women access care, breaking down barriers of distance and time. But for this promise to be fulfilled for all women, we must be intentional. We must build a future that is not just digital, but equitable. So, how do we get there? The path is clear, and it requires our collective action on 4 key fronts. First, we must build a foundation of trust and safety. This means establishing strong ethical rules and clear regulations. We need ironclad, gender-sensitive data protection to safeguard a woman's most private information, like her reproductive health. And we must ensure digital-informed consent is not just a click box, but a clear, culturally appropriate process that every woman can understand. Second, we must bridge the digital divide. Not just with wires, but with wisdom. We need targeted investment to bring affordable internet and infrastructure to underserved communities. But access alone isn't enough. We must provide custom digital literacy training designed for women, giving them the skills and confidence to navigate the digital health world. Third, we must design with women, not just for them. Telehealth platforms must be co-designed with diverse women, ensuring they meet real-world needs and uphold principles of fairness and agency. We need regular equity audits to check for disparities and hold ourselves accountable. And we must work within communities to challenge the stigmas and gendered norms that can prevent women from seeking care in the first place. And fourth, we must ensure our technology is inclusive by design. This means prioritizing low-cost, user-friendly tools that are accessible to all. And in this age of artificial intelligence, we must be vigilant against algorithmic bias, demanding gender-sensitive AI that serves women, rather than perpetuating existing inequalities. To guide us, we need robust monitoring, using metrics aligned with the Sustainable Development Goals to track our progress on health, gender equality, and innovation. The call to action is clear. By working together on these fronts, building trust, bridging divides, designing with women, and insisting on inclusive technology, we can move beyond potential. We can forge a new reality, a truly equitable and inclusive digital health future for every woman, everywhere. We stand at the frontier of a healthcare revolution. The integration of telehealth into women's health holds immense promise, a promise to advance global health, to champion gender equality, and to drive innovation. In short, it has the power to propel us toward our most critical, sustainable development goals. The potential is undeniable: improved access, empowered patients, and a new era of connected care. But we cannot let this potential blind us to the stark realities our research has uncovered, because while telehealth can be a bridge, it can also be a barrier. Our study reveals that its promise is constrained by critical ethical challenges, privacy breaches, complexities in informed consent, and threats to a woman's autonomy. At the same time, persistent access barriers, the deep digital divide, economic constraints, and restrictive socio-cultural norms are leaving countless women behind. Our analysis, guided by the principles of digital health equity and feminist bioethics, leads to one undeniable conclusion: technology alone cannot overcome deep-seated disparities. Simply building the app is not enough. We cannot innovate in a vacuum. So, what is the path forward? Achieving a truly transformative impact requires a fundamental shift. We must move from a tech-centric to a human-centric model. This means participatory design, co-creating solutions with women, not just for them. Inclusive governance. Ensuring women from all walks of life have a seat at the decision-making table. Intersectional monitoring. Constantly checking our progress to ensure we are reaching the most marginalized. To harness this potential, we need coordinated and courageous action. This is not a small task. It is an imperative. We must commit to policy reform that protects and empowers, infrastructure investment that closes the digital divide, deep community engagement that builds trust, and continuous equity audits that hold us accountable. In the end, our mission is clear. We must not advance telehealth as just another piece of technology. We must advance it as a justice-centered innovation. Our goal is not just better healthcare, but a more equitable world. A world where telehealth becomes a tool that empowers all women in all their diversity to claim their right to health and autonomy. Let's build that future together. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Sunday Clement. Thanks for listening.